Has the call.
Speaker, my question is to the Health Minister. Minister, the latest report on government services highlights again that Tasmania's health system is one of the worst in the country. Indeed, 42% of patients presenting to Tasmanian emergency departments wait longer than recommended times, and the median wait for elective surgery is 65 days and up to 588 days for some patients. Minister, the impact of all this is obviously devastating, and just hoping the situation will improve is madness. Clearly a solution is needed that includes more funding and expert advice. So, Minister, as it's clear that the Tasmanian Government is incapable of fixing the mess, will you intervene and help sort it out?
The Minister has the call.
Thank you very much, Mr Speaker, and I want to thank the member for Clark for his question. The Australian Government has contributed to significant increase in expansion in Tasmanian hospital capacity and funding. We've gone from approximately $291 million of funding in the year prior to coming to government to $511 million, or a 75% increase in the previous full year. That will increase, however, significantly over the course of the current 5-year hospitals agreement, which will see an approximately $615 million increase against the last agreement over this 5-year period. So what we see is we will have gone from $291 million of Commonwealth funding to $511 million of Commonwealth funding, and that will continue to increase to what is likely to be almost $600 million of funding. So a doubling of funding and beyond in our time, on our watch. So that's adding significant capacity and capability to the Tasmanian hospital system. In addition to that, though, during the course of COVID, because the member is correct, right around the country where there have had to have been pauses in elective surgery, that has had an impact on people. We have specifically supported the Tasmanian hospital system with $145 million of COVID funding, in addition to that which has been in place through the National Hospital Reform Agreement, through the National Partnership for COVID with the states and territories. So that $145 million is specifically designed to address precisely the issue which the member has raised. In addition to that, under this Prime Minister, we also allocated $20 million expressly and exclusively focused towards a catch-up in elective surgery in Tasmania. That's in place. That's providing 6,000 surgeries which are being able to help people with all manner of conditions achieve the outcomes which they so significantly need to assist themselves. Tasmania itself has also been contributing. I would note that the vaccination rate in Tasmania is above 99% for first doses and 96.8% for second doses. Each is about 3% ahead of the already high national average, which is world leading. Tasmania has added 870 staff to their health system since July of 2020, 152 new beds, and they have 367 ventilators. I did hear recently that, and I quote, "We haven't had enough ventilators in Australia." That statement was false. That statement was in relation to a country which at peak ventilation capacity for COVID required 206. We have 7,500 ventilators in Australia. The Leader of the Opposition made that statement and it was plain false.
The Minister's time has expired.